Hello, good morning. Good morning mga kaibigan, especially our friends from Cebu. Maayong buntag mga babayi. I am Doris Lubal from the I Can Serve Foundation, and I'm your host for this morning in our series of webinars conducted by the I Can Serve Foundation. Um, our topic for today, this is one of a series of talkbacks, no? And our topic for today, of course, is what's on everyone's mind: staying safe and staying alive from this vicious virus called COVID-19. So before we start, I'd like to introduce to you a very lovely kasama of ours, my kasusuk, actually, the president, the chair of our foundation and the co-founder of I Can Serve, Crisan Seldran, who will give us the welcome remarks. Crisan.
Hi Doris, good morning.
Morning.
Magandang umaga, maayong buntag. Thank you for joining us this morning. Dr. Emmett, Dr. Evelyn, we are beyond grateful to have you join us. For the last 21 years, it has been our mission here at I Can Serve to educate and empower women, to give patients access to healthy, to right and timely information, and to ultimately give them a powerful voice in their own healthcare. Should all these we advocate for take a backseat because of the ongoing pandemic? Most certainly not. I think more than ever, we need to separate fact from fiction. We need to seek answers and we need to understand fully. They say it's never a good time to have cancer, but wow, these are extra special ordinary times. As it is, we don't automatically know how to have cancer, and yet add to that the struggles that come with COVID-19. As a breast cancer survivor, 21 years and counting, like all of you, I have so many questions. Truthfully, I worry about going to the clinic for my annual workups, but I also worry about the consequences of my missed checkups. I'm scared to go to the hospital, but I'm also scared what not going would mean. Like many of you, I want to find that balance. I want to find that sweet spot to be healthy, up to date with my appointments and tests, but more importantly, to be safe throughout it all. Among us here today are long-term survivors. There are newly diagnosed. We have fresh new faces. We have some who don't have cancer but are caring for someone who will. And I know we all have many questions. It is said we awaken when we ask the right questions. So let's start asking. Let's never stop asking, and let's start with today. So together, let's educate, empower, and enlighten each one. What are systems for? Salamat, daghang salamat.
Thank you. Thank you very much, Krisan. A line of yours just struck me. Is there a good time to have cancer? In any case, we're going to have this chat for an hour, and we will be taking in your questions. No, it would be good if you really listened in to our resource people, because this time you're really going to hear it from the horse's mouth instead of getting all of our information from a lot of fake sources and people who just want to scare us. We're on Zoom, and we'd like to ask your permission, of course, to record this so we can play it back on our foundation page, Facebook page, later on, para yung mga iba mapapakinabangan yung mga knowledge na na-share, i-share today. So we're also on Facebook, and you can fill in your questions through the chat box. Of course, you can see in the lower, if you navigate, if you put your cursor over the lower portion of the screen, put your questions there, and then we'll entertain them towards the end of the program. And then those who are tuned in on Facebook, you can use the comments field to fill in your questions. So I'd like to welcome our two resource persons for today, staying safe. First of all, I'd like to introduce you to Dr. Ellie May Villegas. Actually, our Cebu sisters call her Emek, so maybe I can call her Doc Emek. She's an oncologist, known to many of our Cebu sisters again as Doc Emek. She is section head of the Medical Oncology Department of the Cebu Doctors University Hospital, director of the Cebu Cancer Institute of Perpetual Sucor Hospital, and she was the past president of the Philippine Society of Medical Oncologists. Dr. Villegas, say hello.
Ang buntag.
Oh, pretty pala you are. I couldn't see you when we were up in the mountains. Okay, and our second guest, our second resource person for this morning is Dr. Evelyn Rojas, an infectious disease specialist, faculty member of the College of Public Health, University of the Philippines, yay, UP, and president of the Philippine Hospital Infection Control Society. Good morning, Dr. Rojas.
Morning, Tita Doris, and good morning to all our viewers. Good morning, everyone.
Okay, so listen up, guys, because I'm sure we're going to get a lot of first-hand information from our resource people today. So to start with, may I call you Dr. Eva? Or get, I think, a lot of information from all sources, and then in the process, people get confused. So can you tell us in the simplest terms and lay women's language, what exactly is COVID? Doc Eva.
Okay, so thank you, Tita Doris. So COVID-19 is the disease. So it's considered as a novel disease because it's a new disease caused by a novel or a new virus. So novel, bago, ibig sabihin, it was not discovered yet before. So it's only during this 2020 that we have this virus causing this novel or new disease called COVID-19. So COVID-19 is the disease, but the organism causing it is a virus. So the SARS-CoV-2 virus. So it's a novel viral disease that mainly hits the lungs. So it mainly affects the respiratory part of the body and eventually causing sepsis and eventually causing respiratory failure, which is the usual exit of people if ever they succumb to this dreaded disease.
Okay, I hope everyone understood that. But so it's not flu, it's not pneumonia, but it's a disease caused by the virus which attacks the lungs. So people confuse it. So let's go to the use of masks because I think everyone is a bit confused. We get again information from all sources. Can you tell us, Doc Evelyn, what mask is the safest to use? Should they be the surgical type? Should they be the cloth type or paano?
Okay, so good question, Tita Doris. But I think before I discuss face masks, I just want to tell everyone, why do we use masks? So why do experts or why do WHO or the government advising all of us to wear masks? Because before, during the start of the pandemic, the recommendation is only selected group of people should wear masks. But now the recommendation is universal masking. So all of us, wherever we go, the recommendation is to wear masks. So what's the rationale or what's the use of this mask? So it's evidence-based, based on science. During this past 6 months of the pandemic, so scientists or researchers were able to generate data or information that supports the use of masks, mainly because based also on the nature or the course of the disease. So bakit nagmamask? Kasi it's towards the mode of transmission of the virus. So kailangan magmask to prevent getting it. So speaking of mode of transmission, how do we really get the virus? So I just want to emphasize that. Kasi there are a lot of myths. Okay? If you don't know how it is mainly transmitted, how it is really transmitted, we get running, di ba? So most of people get running because they thought that all of this we can get everywhere or anywhere the virus. So mainly, I just want to briefly discuss that the virus causing COVID-19 is mainly transmitted via human to human. So what we call the respiratory droplet mode of transmission.
Oh, wait, excuse me, Doctora.
Yes.
Can we please ask the participants to mute their audio para lang hindi ho ma-disturb ang ating mga resource people while they're speaking. Please mute your audio or the host, si Carla. Can you mute everyone's audio except Doc Evas? Thank you.
Okay.
Okay, ma'am.
So going back to the mode of transmission, as I've said, the main mode of transmission of the virus is via human to human. So what we call as respiratory droplets. So meaning, if you have an infected person, for example, I become an infected COVID-19 patient, and then if I directly sneeze or cough in front of a susceptible person, for example, you, Tita Doris, you're a susceptible host, meaning you're at risk for getting the virus, then that's the main mode of transmission. That's why we recommend using masks.
Can you
Because,
tell us what the best kind of mask is to use? In fact, I brought samples here. Oh.
yeah,
So is this one okay? Or
yeah,
can we have fashionista masks? Or
okay. Sige. So that's, you're holding a face mask, Tita Doris, and the other one on your left is a cloth mask.
cloth, yes.
So the mask mainly prevents the spread of transmission from the susceptible, from the infected patient. For example, me, for example, if I have COVID, it prevents the further spread of the virus, and also at the same time protecting the susceptible host so that you will not get the virus also. It's somehow a double protection. So coming from the infected host and the susceptible person, for example. So in the community, the recommendation is actually just a cloth mask or face mask. So either actually. But in the hospital, there's a different set of masks recommended for healthcare workers. For example, what we usually hear, the N95,
Yeah.
okay, N95 or
Yung parang may vent.
ito, this is an example. Yeah, meron akong prop. So this is an example of N95 po. And it's usually recommended for healthcare workers in the hospital. However, for us in the community, for example, we are not healthcare workers, actually cloth mask or a face mask will do. But what we always advise is that it's not just wearing masks, but what is important is properly wearing masks. Because sometimes if we wear masks, but if it's not proper, you can still get the virus. So what is the proper way of wearing masks? So as we say, so there's only one way of wearing masks. Before kasi merong advice na papalit-palit the lighter side if you're sick, or the colored part if you're not sick. So we recommend that there's only one way of wearing mask. So this is the correct way of wearing mask. So the lighter part is inside, and then the outer part is, the colored part should be on the outside. Okay, so there's a rationale with that also in terms of the water resistance and then the protection. And then you just wear the mask. So you see the parang bakal here, okay? So it should be on the upper part. So you put it there, and then the strap you put in your ear loops. Okay, so the proper way of wearing mask is that it should cover both the nose and the mouth, and you just put below the
Oh, you have to pull it pa. Like that.
Pull it so that it can support, and then you just pinch here, ito yung parang metal part. So as to support the mask. Okay, so pero sabi nga nila before wearing mask, you have to inspect pala. You have to inspect that you have a new mask, walang butas dapat, okay, because otherwise it will defeat the purpose of your protection. And then you perform always hand hygiene, okay? Putting and also removing the mask. So very important that we still follow proper hand hygiene, what we call hand hygiene, whenever we remove the mask.
And what about touching the front part? We're also told that we shouldn't touch the front part.
Yes, Doris, yes. It's a no-no, di ba? Sometimes I always see people, pag naka-mask sila, yan, hawak ng hawak, ganyan ng ganyan. But it's a no-no because once you have this mask, we already consider this as contaminated, the outer part, because it's the exposed part. So you should never touch it whenever you use it. So you just touch the strap whenever you remove it or you want to adjust it. And always perform hand hygiene.
Doc, are these washable?
The face masks are considered to be one-time use only, the face mask. But the cloth mask can be washable. So si cloth mask, pwede pong malabhan kasi nga it's easier to be, mas madali rin siyang ma-soil eh. So, mas madali rin
Okay.
mabasa. So, it can be, it's washable, you can reuse it. But for the face mask, as much as possible, when it is visibly soiled, okay, so kung basa na po, definitely it will not serve its purpose. It should be disposed already.
Okay. Doc, binigay sa akin to ng kapatid ko. Meron
Yes.
pang filter sa loob. So it's really dual, I guess it's really to be safe. But the others I see on the road though, hindi ganito yung plain cloth lang talaga, especially yung mga kababayan natin na naghahanap buhay, basta gagawa lang sila ng ganito tapos ano. Pero dapat so talaga, di ba may filter? Is that right?
Actually, Tita Doris, in the community, so it really doesn't matter. But the filter will be
Okay.
additional benefit.
Okay.
Kasi
Okay.
shown that in the community, as compared in the hospital setting, so in the community as much as possible, it's not that parang concentrated, the people, we don't know. So as long as you practice yung other minimum public health measures like physical distancing and then hand hygiene.
Okay. Should young children wear masks also? Mga bata?
Yeah. The Philippine Pediatric Society, so I'm not a pediatrician, but I hear from pediatrician, I think as long as more than 5 years old, I think, and kasi ang babantayan mo pag children, yung issue of suffocation, they might get suffocated with face mask, so pwede naman, okay? Pero kasi for children kasi it's not recommended that they go out, diba? Bawal silang lumabas, just like seniors, so if in the house, actually if nasa household lang, it's not recommended that they wear mask.
Oh, okay. What about Doc? Ito na-experience ko kaninang umaga kasi I exercise quite a bit outdoors. And then I get very embarrassed kasi when you're not wearing a mask, people really stare you down, di ba? Parang ganon. Tipong I mean, while you're walking or running, this literally gets soaked. I mean, parang binabad mo talaga sa tubig because of the pawis. What do you recommend? Is it really necessary when you're exercising outdoors to wear a mask? Di ba nakakasagabal yun sa lungs or nakaka-damage ng lungs or something?
So, Tita Doris, kasi today, di ba nga, as I've said, the recommendation is universal masking. So, whenever you go out of your house, you have to wear mask, whatever your purpose of going outside be. Okay? So, kung mag-exercise, kasi lalabas ka nun labas ka ng bahay. So, you still have to wear mask. So, as long as you have, sometimes dapat mayroong backup na mask. So, going outside, sabi nila, you have to bring at least a backup cloth mask so that whenever it will get soaked, you have an alternative mask.
Okay. Okay, we'll get back to you later, Doc Eva. In the meantime, I'd like to ask Doc Emic. Ang cute-cute naman ng nickname ninyo. You know, a lot of, I suppose because we're all breast cancer survivors, we're more compromised than other ordinary or normal people. My question is, how badly compromised are we as survivors to getting COVID? Are we more vulnerable than the ordinary? Yeah.
Sorry, I'll unmute first. There's been this notion, even from the start of the pandemic, that cancer patients in general are really immunocompromised. But we have studies now, in fact, they're already published, na-publish na yun, na they are not for COVID. Meaning, ang talagang risk factors lang for those cancer patients dying because of COVID are those for the general population, elderly, tsaka yung may mga comorbidities, and unfortunately, males. So yun lang. Even if you're undergoing chemotherapy, radiation therapy, hormonal treatment, or immunotherapy, you are not at greater risk for dying from COVID-19 disease. So yun yung misconception na we want to dispel.
Okay.
And we have studies for that. In fact, yung UKCC, University of Birmingham, so UK Coronavirus Cancer Monitoring Project. So siya yung una na nag-prospective study. In fact, this is by Dr. Lee, and that was already released in July of 2020, na Ang factors lang talaga na nakakapag-high risk ng cancer patient are those with comorbidities, elderly, and the male population. Whereas in another study in the US, University of Vanderbilt, by Dr. Warner, the same risk factors lang ang nakaka-increase ng chance of dying from COVID-19 if you have cancer, plus those who received, well, it's a drug, yung azithromycin and hydrochloroquine. So it is not true that you are immunocompromised, and you being immunocompromised, you would die more, there would be more cancer patients to die of COVID-19, hindi.
Okay.
But marami ring, di ba, cancer is a disease of the elderly. So the general protocols should be in place for this subset of population. Na talagang lalabas lang, aside from staying at home, lalabas lang for essentials. But people are forgetting na kala nila yung essentials, bibili ng pagkain. They forgot that one of the essentials also, if you are a patient, whether chronic disease, whether you're a diabetic or you have hypertension or somebody with cardiovascular disease and with cancer, essential also is magpatingin. Yung mga low risk, pwedeng teleconsult, telemedicine, phone call, ganyan, or face-to-face if you are medium to high risk.
Okay. Well, so that actually leads me, Doc Emic, to my next question. Ang dami-daming cancer patients na talagang sobrang takot pumunta ng hospital because, they're scared to get COVID because they know hospitals, of course, treat patients and all that. They're scared to go for their, whatever, surgery, chemotherapy, radiation, and then they postpone their treatment. I'd just like to ask you, is there a reason for our cancer patients to be scared to go to hospitals?
For anybody, not only for cancer patients, there was a reason, especially at the start of this outbreak, the outbreak of the pandemic. There was reason because we knew very little of COVID-19 disease. Tapos ang daming namamatay kaagad, severe. Marami pa doon ang mga healthcare, mga frontliners. But now, 6 months into the pandemic, wala na. Medyo new normal lang. But by saying so, kailangan follow pa rin the general health protocols. And anyway, health protocols naman are in place, whether you're in the clinic, going to the clinic of the doctor, or going to the hospital, ando naman yung mga protocols. By the protocols, I mean, there's a control of foot traffic. Everyone do not go there kasi gusto lang nila. If hindi emergency, kailangan naka-appointment. So there's a control of foot traffic. Ideally, there's one exit and one entrance for all the patients. And there is a triage or a screening system. Ang triage, may healthcare worker doon na naka-station either sa clinic ng doctor, especially kung medical arts, or sa hospital. Merong health declaration form. I see even in groceries or in malls na merong health declaration form. Mas tedious lang siya for health institutions. And then we strictly enforce physical and social distancing, talagang hand washing, alcohol, sanitizing if there's no soap and water, and wearing of PPE by the healthcare worker, not necessarily of the patient.
Not the patient. So the cancer patient can just wear anything ordinary. Or
The
PPE
cancer
then.
patients or patients in general should wear anything that they're comfortable with, as long as the basics are there. The basic for PPE for everybody is face mask na mention ni Dr. Eva, plus face shield na ngayon. Included na ang face shield. No need even to wear gloves. Kasi minsan ang gloves, you feel that you are securing yourself, but you forget to sanitize. So if you're wearing gloves, kailangan naka-alcohol pa rin every now and then.
Okay. And see, in my notes, si Cara put, Doc Emmett, you may want to quote PSMO stats that or say something about the initial lockdown. 70% plus of patients deteriorated because of the delays.
Totoo yun. So our local society, we call it Philippine Society of Medical Oncology or PSMO, headed by our current president, Dr. Bill Ramos. He initiated a survey na yun na nga, more than 50% actually of patients have recurrences, have progression of the disease, or even die because of the cancer, not because of COVID, dahil nga sa delay. And worldwide, this was already published in June 20 of 2020. If you type in Google yung Medscape News, it's already there. 10,000 cancer patients have died because of COVID-19 delay. So malaki yun. Bakit sila namamatay? Kasi nga, they forgot to go for their screening. Yung mga high-risk patients na talaga nagsiscreening, especially yung breast cancers, colorectal cancer, and lung cancers, in which may mga screening protocols. Di ba, alam niyo yung screening for breast cancer, it's mammogram. Maybe later on we can talk about this also. For colorectal cancer, yung mga colonoscopy or kahit yung mga stool exam. And sa lung cancer na high risk for developing lung cancer, yung mga low-dose spiral CT scan. So, nakakalimutan na because they're very scared to go for their usual screening. So, yun. Hindi na nadidetect di ba? Prevention is better than cure, and it's better to diagnose cancer at the early stage rather than in the intermediate or advanced stage. Yung nakakalimutan na yun. And at the start of the pandemic then, all elective surgeries were stopped. Why? Because of the surge, lahat ng mga healthcare workers, I mean yung ibang onco-nurses na field na doon sa mga COVID ward, yung mga healthcare workers na iba naka-quarantine. So there was really a lack of manpower, kaya din nadidelay lahat ng mga treatments. And of course, scarcity of transportation for most patients na wala sariling sasakyan. Kasi nga naka-ECQ, naka-lockdown. So mahirap din ganun. But now, we want to encourage patients, yung mga low risk, meaning yung mga patients who've already finished their treatments, and especially for breast cancer na naka-oral lang, and they are on survivorship follow-up, pwede na yun kung takot silang, they cannot really go to the doctor, to the clinics, they can do teleconsult, they can arrange with the secretaries. Kung walang formal platform yung doctor for teleconsult, they can do that. I mean, the doctor can initiate, like ako, we look at the chart and then we call the patient one by one. Kung if their labs come in. So pwede ka doon. But those high or medium risk, kailangan face-to-face and kailangan ituloy yung treatments. Kasi nga, those undergoing chemotherapy, minsan, yung iba hindi na tumutuloy. Those who have finished neoadjuvant chemotherapy, di ba yung neoadjuvant, you give the chemotherapy first before you do the surgery. Dapat, after neoadjuvant chemotherapy, susundan ng surgery a month after. Kasi nga takot, hindi nagagawa. That is not the same result as delaying it. You can only delay maybe 1 to 2 weeks kung high risk ang case. So, basic is the doctor or the attending physician will stratify all patients. Those who are medium to high risk must continue their follow-ups, their screening, their treatments, their laboratory workups. Tapos yung mga low risk, pwedeng ma-delay.
Okay. So there we have it. The Dr. Emi could not have said it any clearer and any better. Please do not delay your treatment for those who are medium and high risk. For those who are low, maybe a bit, but just not so long also. That's what you're saying. Under no circumstances should you delay your treatment. Now, I'd like to ask Doc Emick, for long-time cancer survivors, like Krisan, like myself, ako mag-15 years na ako in November. Should we still continue with our annual checkup?
If there is no barrier to that, you may continue, but then you belong to the low-risk population, meaning kasi nga, everyone is by appointment basis. So, kung yung mga diagnostics like ultrasound of the breast or yung mga sonomammogram, mammogram, facility centers, hindi pwedeng mag-accommodate ng too much, kagaya before, di ba? Pag Pink October, 1,000 patients a day, hindi pwedeng ganun. If you cannot be accommodated during October, you can very well have it done in 3 months' time or even early part of next year. But for those patients whom we want to really follow up, especially for breast cancer, yung mga kakatapos lang mag-chemo, syempre high risk yun kasi nag-chemo siya. dapat ma-follow up pa rin yearly yung mga mammogram nila. And for those patients na wala namang cancer, but they have benign disease like, for example, ductal carcinoma in situ. So that's a precursor to developing breast cancer. Kailangan ituloy yun. And especially for those patients, most of you are breast cancer patients and survivors, yung mga triple negative, ER, PR, HER2 negative, high risk yun. Yung mga HER2 positive, yung may HER2 plus 3, high risk yun. Kailangan walang delay sa ganun. So triple negative, HER2 positive. What if hormone receptor positive, yung mga ER, PR positive, medyo mabait yun, di ba? Yung tinatawag na luminal A, ER positive, PR positive, HER2 negative, you may delay ng konti, but always ask permission from your attending physician kung pwedeng i-delay ng konti. So yun yung mga risk stratification in terms of breast cancer. It will be according to your disease type and of course the stage. And segue ko na rin, Tita Doris, yung sa treatment, hindi lang naman sa medical oncology, di ba? There is surgery. I mentioned that already.
Yes.
Kung nag-neoadjuvant, itutuloy yung schedule ng surgery. Yung mga radiotherapy. So this is quite challenging because ang radiotherapy naman hindi siya one time. Okay lang kung rectal cancer. We have protocols na imbes 35 days sa rectal cancer, pwedeng 5 days high dose. But for breast cancer, talagang 30 days.
Every day, right? Yeah.
Again, we go back to risk stratification. Kung sino yung pinaka-priority. Triple negative disease, HER2 positive disease, and if ever kung ER, PR positive, HER2 negative, na high risk, meaning very young, wala pang menopause nung na-discover yung breast cancer, yung mga ER, PR positive na nag-chemo, kasi nga malaki yung mga lymph nodes nila, malaki yung mga tumor, kailangan pa rin itutuloy yung mga radiation sa mga ganun. Anyway, in cancer treatment facilities, the same social distancing. Pag nakakita nyo sa clinics ng doctors, di ba, we have physical barriers. We do not encourage the SO, your significant other, yung bantay, na sumasama sa loob kasi nga maliit lang naman yung space. If nagkikimo yung pasyente, physical distancing pa rin.
Okay.
We have 2-meter distance in between patients. So may and we always follow yung health declaration. Ang kaibahan sa cancer patients is, kung sinasabi ng mga infectious nila Dr. Evelyn na kailangan, pag may treatment ka, whether dialysis or cancer treatment, hindi kayong in the 7 days, dapat naka-quarantine ka rin. Hindi yung ikaw grocery na ganyan. Pwede naman magpa-deliver, di ba? Because we do not want you to be exposed somewhere else. Parang po nga sinasabi ngayon, my battle cry is, where is the safest place to be? It's your home.
Home is your fortress.
But it's also the hospital and the clinics because we follow strictly protocols. The malls is the safest place to be in, nor the supermarkets.
Okay, so dapat hindi matakot ang mga ating mga kasama to go to the hospital, right? And I hope you ladies out there were able to get everything si Doc Emick said. But if not, we're going to post this recording anyway sa foundation page ng I Can Serve so that we can go back if we missed out on any of the information given out today by both our resource people. Now, bumalik ko tayo kay Doc Eva. Actually, Evelyn, in the beginning when this COVID thing was new, everyone was super paranoid, as in, di ba? Yung kung lalabas ka gano'n, pagpasok mo sa, bago ka pumasok ng bahay, you take off everything, you sanitize your shoes, you spray yourself with alcohol, and you know, and then you go take a shower, hot shower para magpatay lahat ng virus. Is this all necessary? What's the protocol? I'm coming from outside. What should you do when you get home?
So that's very true, Tita Doris, and I think that's also understandable. So during the first part of the pandemic, all of us, so even as healthcare workers, we know very little. So novel, it's a new disease. We don't know, actually, we don't know at all, unless na lang yung other about the virus maybe, but the mode of transmission, so during the first part of the pandemic, it's not really established. But as what Dr. Emick said, so we are going to the 6th month of the pandemic already. So studies were done already, and the mode of transmission was established already by the World Health Organization. So I just want to add, so I've mentioned a while ago, the main mode of transmission of the virus is via human to human, via respiratory droplet. But there is another mode of transmission of the virus, which is an indirect mode of transmission or via contact. So meaning when we touch contaminated surfaces, because studies show that the virus causing COVID-19, SARS-CoV-2, can be viable or can remain viable, can stay on surfaces, so inanimate objects like tables or your chairs or sa doorknobs. Okay, so it can remain viable for hours to days if not properly cleaned. Okay, so yun dapat eh. So pwede siyang magstay on these surfaces kung hindi natin lilinisin at i-disinfect. However, whenever we clean this and disinfect, and of course, when we wash our hands, there should be no problem with that mode of transmission. Kasi before yun ang takot ang everyone.
But Doc, like what should I do? Okay, galing akong supermarket kasi ako I live by Manila. When I come back home, is it still, should I take out everything and should I disinfect all of the groceries? Should I make babad the vegetables in acid or paano ba?
So yung cleaning, environmental cleaning and disinfection is part of the infection prevention control measures for COVID-19. So if ever you came from the groceries, you have all of these goodies, so you can just disinfect or clean the maybe the plastic, the grocery bag, okay, but not necessarily the food. So may issue din naman sa food in terms of food safety kasi you cannot clean. We usually use the disinfectant, the household bleach, for disinfecting for COVID-19. So of course, you cannot apply household bleach with our food, diba? So walang COVID, but you'll have issue with food safety. So they say, experts say that you just clean this, the usual cleaning. So wash it with water, running water. And very vital kasi dyan is that you always wash your hands. Kasi however, gaya nga sabi kanina ni Doc Emick, gaano kalinis, sometimes you still wear gloves. But if you don't wash your hands, so you can still get the virus. Remember, the virus can only enter our body via the mouth, the nose, and the eyes. So if respiratory droplets or human-to-human transmission, you can get it by inhaling. But with the indirect mode of transmission, you can get it whenever you have dirty hands that you touch on the surfaces and you did not perform hand hygiene, and you touch it sa mouth mo, sa nose, or sa eye. The only mode of...
Can alcohol take the place of hand washing?
Yes, Tita Doris. So hand hygiene is recommended. So hand hygiene is the general term. So it includes hand washing with soap and water, and also the use of alcohol-based hand rub or
alcohol-based.
Kasi before, nagiging issue, people daw cannot perform hand hygiene kasi walang faucet or walang soap. But nowadays, we have these sanitizers. So it should be part of our essentials. But it's part of the new normal already.
70%? Tama ba, Doc? Sabi nila dapat at least 70% alcohol.
Yes, so we should bring this alcohol-based hand rub. So the recommendation is 70% ethyl alcohol, actually.
Ethyl alcohol.
So basically that concentration, Tita Doris.
And then what if ako I'm still paranoid when I go to ATM machines. Kasi di ba lahat ng klaseng tao touch the keys and everything. So what would you recommend? Should we spray all the keys first before touching, or paano ba? Or after? How do we do this?
So actually, it's the responsibility of the establishment. For example, in a bank, so it's the responsibility of the bank to regularly clean and disinfect their office or their space. For example, those ATM machines, it's the responsibility of the bank, for example. However, on our part, what we can do is actually to perform hand hygiene. So again, so paulit-ulit, but I always emphasize hand hygiene because it's also considered, it's actually considered as the single most effective preventive measure, not only for COVID-19, but for other diseases. So our
Okay.
hands are very powerful in transmitting the organism. So if we maintain our hands clean, for example, you touch those ATM machine, so kahit nag-touch ka, but you perform hand hygiene, you use your alcohol-based hand rub, and you minimize touching your mouth, your nose, and your eyes, you cannot get the virus.
Mhm. And then I have another question, Doc Eva. This one, because syempre by this time, a lot of families miss their mga apo, mga anak, and then they sometimes organize small gatherings of 3 or 4, maybe at the most 6 people. Is it correct to say that that um, they shouldn't eat together? Para ganon? Or else daw, when you eat, dapat you're not across from each other, but still distanced? How?
Yes.
But, I mean, if you're sure for well, no, sabagay, you can never be sure kasi that's how it gets transmitted. You think your best friend is safe, you think your son is safe, pero they go out. So how would you, what advice would you give?
So yes, Tito Doris. So I think that's part of our adjustment in this new normal, particularly for us Filipinos. So I understand. So I myself, so we are very close knit to our
Yes.
members. So we really like chika-chika, diba?
Mm-hmm.
So things. But
Tsaka tachi-tachi.
yes, of course. So, but I think it's
Mm-mm.
big adjustment for us in this time of pandemic. So as much as possible, they recommend avoiding congregation or having these parties because what happens ba pag, when you have parties or you have an event? So when you eat, okay, of course you cannot eat with your mask on. So you have to remove it and then you're very at risk because wala kang mask and then you're close to each other. Okay, so that's the reason why they recommend as much as possible to avoid eating together, particularly in
Okay.
offices or in hospitals or in
Okay.
and very they follow the rules when they attend to the COVID patients, but sometimes pag break time na di ba, naglo-loosen up, so they remove their mask,
Yes.
physical distancing. So unfortunately, we have to be on guard all the time. Okay, so yun nga sinasabi namin, wag mapagod to follow all these minimum public health measures. So
It just
if
takes so much, it really takes so much discipline, right? And commitment because no matter how careful you are, just parang ang feeling ko, parang you're so careful, but just one slip up and you get it, di ba? And then you're going to say, no, but I never even went ganon, I never ganon, but just once it happens. And ako, unfortunately, I've had a very, very close friend die of COVID. In fact, I have about and personally know about 3 or 4 others, and it's just really, really devastating. But I think it behooves all of us to know that we should not let up on our safety protocols because just one slip up and and that's it. Thanks, Doc Eva. So let's go ulit kay Doc Emmett. Yung battle cry namin sa I Can Serve talaga is early detection is your best protection. And then I'm sure alam niyo na every October, we commemorate Breast Cancer Month where I Can Serve actually goes out on outreach programs to underserved or disadvantaged communities, or we try to promote free breast screening with a local government unit. Now, what, Doc Emmett, do you think we should tell our the women out there who are over 40 during this time? Should they still go out and get their mammographies, or anong gagawin namin?
Ito, Doris, regular cancer screening is still very important, especially doon sa top 3 na na-mention ko a while ago, breast cancer, lung cancer, and colorectal. Kasi nga, these are also the cancers which we can do so much to improve quality of life and survival. But then, na-mention ko rin na the treatment facility or the diagnostic facility can only accommodate so much. So, kung dati thousands of cancer patients pwedeng i-accommodate, ngayon risk stratification pa rin. So, kung yung talagang kailangan to follow the annual or the once a year mammogram is really for those patients who have triple negative disease, kung may cancer na ha, triple negative disease, HER2 positive, or those ERPR positive na young, very large tumors to start with, may lymph node positive, yon. For those who do not, for screening, for those who do not have cancer yet, pwedeng i-delay ng konti. So, if hindi ma-accommodate for 2020, there's always a 2021. Early part, maybe, of 2021. Because, kailangan din, physical distancing ang masusunod dun sa mammogram facility.
Okay.
And, when you make your appointments, do not be embarrassed or don't be shy to ask that facility, how often do you disinfect your what do you call this, either your CT scan or your mammogram or your ultrasound. Kasi karapatan mo yun. And you might want to ask also if may PPE, yung ganon. But pag sasabihin ng treatment facility na mapunta ka lang kasi walk-ins, parang that's not a very good center to to have your screening done kasi nga walang physical distancing.
Would you, Doc Emic, be offended if, for example, I, as the patient, ask you before going for an appointment what your protocols are in your office, if I ask you?
Not at all. We're even happy and we'll gladly oblige. Kasi nga, for everyone's education, kasi, di ba, word of mouth, word gets na, ayan, maganda pala kasi meron silang mga barriers. And I forgot to mention earlier, for all patients, whether COVID or not COVID, do not be surprised that we really get RT-PCR swab testing. And hindi nalalayo yung mga patients undergoing dialysis and chemotherapy. So before the start, for all patients undergoing treatments in the oncology units, we require a negative RT-PCR swab test. And not naman every 3 weeks, ang repeat nun is per physician's discretion na lang kung may mga symptoms, ganun. Pero bago either hematologic procedure, whether blood transfusion lang yan, or bone marrow, or chemotherapy, immunotherapy, radiation therapy, surgery, lahat dapat may RT-PCR negative na swab test.
Okay, so that's clear. I was just wondering, in the country but today, are there stand-alone cancer centers? Yung hindi sa loob ng hospital?
We do not have a standalone cancer center or oncology facility as of yet. All over the Philippines, wala pa. So sana with the cancer law, it was signed this year ba? Sana magkaroon. But that's not also to deter patients na wag nang itutuloy yung mga treatments sa oncology facility because clean facility siya. Nasabi ko nga during the tech run, na most of our patients and the healthcare workers sa oncology unit na nag-COVID positive did not really come from the hospital. From community transmission na dadala ng pasyente na hindi naman sinasabi na meron silang symptoms or yung healthcare worker, she was exposed in her community. So yung ganun. Kaya basic health protocols pa rin ang susundin.
This one, do you think the government should do more during the pandemic for cancer patients? As an example, kasi earlier on, si Giselle, yung pamangkin ko, and sila Carla, they were arranging for patients who did not have transportation to get their chemotherapy and all that. And then parang tumagal. I was thinking, shouldn't government have a role here, or at least in Department of Health, for those who are, again, in the disadvantaged sector, who cannot get themselves to the hospital for their chemo or all that?
Yes, definitely. In a pandemic kasi hindi lang naman puro government, di ba? It has to be a joining of forces between the LGU and the LGU, national government, private sector. Kung sino yung mas nakakaluwag, like, for example, in Cebu, kung hindi government, may mga private sectors na they lend their buses para lang
Okay.
doon sa mga healthcare workers and doon sa mga patients na cannot naman go to and fro for treatments.
Okay. I think it might be, it's almost 12 o'clock. Just one last, there's a topic here which I think Miss Clara put here for me. She says that one of the most makulit people are the seniors and the elderly. They hardly stay home, like they go to the mountains. So how do we deal with them now? I'm laughing because, di ba, during the dry run last week, I was really in the mountains. But to me, I really observed health protocols. But in that place, in Bataan, wala naman, they never even heard of COVID there, and the nearest neighbor is like 4 kilometers away. But if there were someone old, I mean, the folks, for example, friends of mine who are my age or more, how do we convince them, you think, to stay safe?
We are
Dr.
already
Either
in
of
the
you can answer.
we're already in the 200,000 mark. Isn't that convincing enough? Kasi yun
Okay.
talagang vulnerable, the young and the hindi man old, the ones young, mga elderly,
Young
talagang
ones.
vulnerable, and those
Okay.
with comorbidity. So essentials lang talaga. Essentials lang ang pwedeng lumabas. Kasi en route doon sa mountain, di ko alam kung would you be exposed to, yun lang you are exposing yourself. The other people, kasi di ba pag lumabas ka,
Yes.
kakatakot. Many are wearing their masks under their chin. And then lahat ng face mask, kahit sa mall, okay, dapat may face shield. Once they're inside the mall, lahat naka-headband na ang face shield. Ano yun? You cannot go around.
Parang nag-abala ka pa mag-mask. Nandiyan naman.
Doris, I just want to
Look,
add,
Evelyn.
for seniors, actually, children and then elderly more than 60 years old are the high-risk group of population.
Yes.
So you are categorized under the high-risk group of population. So why high risk? So as said by Dr. Emick, so you're more at risk of getting the disease, and not just getting the disease, but getting a more severe kind of disease.
Okay.
As to those population which are not elderly and the children. So hindi lang kayo at risk for getting COVID, but you're at risk of getting severe or critical COVID condition. So that's the main reason why the government, the Department of Health, or the healthcare workers, the health experts are advising this group of populations as much as possible to stay at home so as to avoid contact, because in the hierarchy of control of control of getting the virus, at the top of the hierarchy is the elimination. Okay, so of course we cannot totally eliminate the virus because we cannot see it, but its counterpart is physical isolation or physical distancing, or the because if you do not have contact, you do not have encounter, di ba? Sabi ko nga, mode of transmission is via respiratory droplet. Then you will not have the chance of getting the virus too. So if possible, you can stay at home. Pwede naman sa garden, okay? Or kung sa mountain ni Tita Doris, as long as there are wala gaanong tao. And
wala
then,
talaga.
Wala, ikaw lang.
Ako lang. Nakita nyo naman, di ba, last week, nag-iisa ako, me, the forest, the birds, and the trees. Yun.
And you have good ventilation dun siguro sa forest.
Yes.
Okay lang, pero here in the city, we really do not recommend paglabas ng seniors. So I see nowadays we get a lot of, hindi ko tinatakot, but this is a fact. So we get a lot of critical to severe to critical COVID cases who are elderly. So more than.
Are there any vitamins that you can suggest everyone takes? Vitamins, and what kind of diet should people have to remain strong?
So COVID-19 is a viral disease. In general, viral diseases are treated supportive. So supportive meaning the usual maintenance of proper nutrition, okay, so sanitation, and then vitamins will act as supplements. So you can take vitamin A, vitamin C, or zinc. Okay, so yun yung mga studies, but not specific pa. So no specific vitamins recommended for SARS-CoV-2 or for COVID-19.
And
if
what
I may
about
add lang sa vitamins and supplements, diba for cancer patients, especially breast cancer patients, to reduce the chances of having osteoporosis kasi nga women are prone to osteoporosis, lalo na Asiano, especially so if they're on hormonal treatment or they have chemotherapy, we give them vitamin D3 as well. And the reason for that is really it will reduce a gene called BCL2 so that the cells will become more sensitive to your hormone treatment or radiation or your chemotherapy. In COVID also, that also has a role, yung vitamin D3. Nerdy stuff, but it can reduce yung nuclear factor kappa B, yung B cells, because it will increase your T cells to T cells, diba? It will combat anything. So it will increase your T cells to become more active. And a note on precaution on vitamin C. Everybody is taking vitamin C. Nakakalimutan na sa pagkain, lahat naman kinakain natin almost may vitamin C. Itlog, rice, everything. So why not get it from your diet? Because many of our cancer patients also have borderline kidney function. Lalo yung mga nakadialysis. So, hindi pwede yung mga 1 gram ng mga vitamin C because it will be detrimental. So, there's no sense of really having high doses of vitamin C. And for those patients, not only for breast cancer patients who have very active tumors, that's why oncologists really refrain from giving too many multivitamins as opposed to what the alternative doctors would tell you. Kasi yung mga legitimate doctors will refrain from giving too many multivitamins kasi nga mag-a-active din yung tumor. So better have a safe regimen for exercise and diet.
Okay. Thank you very much. We'll just take one question from the audience. This is for Doc Eme. Pwede po ba akong mag-pneumonia vaccine? Naka-letrozole ako.
As long as, so kung pwede bang mag-vaccine, we recommend vaccination pag hindi pa nagsa-start yung mga cytotoxic chemotherapy. Yes, you can do that. And for those on hormone treatment only, yes, you can. But for those undergoing chemotherapy, lalo na live vaccines is a no-no. So we do all vaccinations prior to the start of immunotherapy or chemotherapy.
Okay. The other, maybe I'll just ask this one more question. For a patient who just underwent MRM and is about to undergo first chemo cycle, what are the key things to prepare and watch out for? About to undergo her first chemo.
So in the context of this pandemic, dati kasi ang mga pinapa-flu and pneumonia vaccine namin are the yung mga may comorbidities or the elderly. But now, we recommend flu and pneumonia vaccination for all patients about to undergo systemic therapy, lalo na yung mga intravenous chemotherapy. So, at least 2 weeks prior to that. Yun lang naman ang kailangan i-prepare and really stick to the diet which is healthy. Napapansin ko,
fruits
yung
and
mga cancer patients, doon lang sila nag-healthy diet pag may cancer na. So, dapat bago cancer.
Anyway, so medyo nag-overtime na po tayo. That's all we have for today. Ang bilis-bilis ng isang oras. When you're in good company and everything is informative, that's really how it goes. So join us again for more talkbacks. But before that, we'd like the last word or last message from two of our resource persons. Maybe si Doc Evelyn first. Would you like to say something to our audience, our participants?
So I would like to thank the I Can Serve Foundation. So in behalf of the Philippine Hospital Infection Control Society, so we would like to thank particularly Ma'am Cara, Ms. Cara, for inviting me and to represent the society and giving this opportunity to, of course, to properly educate all of us regarding COVID-19. So as what they say, so we are on the 5th month or going to the 6th month of the pandemic already. And there's still no available vaccine and effective medicine against the virus. What we have for now are these minimum public health measures. So we've discussed the wear of masks, maintenance of physical or social distancing, and of course, regular hand hygiene. So while we do not have this medicine yet for the disease, let's utilize or capitalize on these measures so as not to contribute in the spread of the virus. And I just want to emphasize also and to add that while we are living now in a pandemic, so we are in a pandemic now, let's not forget, okay, sinabing Dr. Emick, that there are also other diseases and we can contribute by protecting ourselves. So if we will not spread COVID-19, we can help its spread, prevent its transmission, we can decrease the cases of the disease, and then we can also attend to other medical conditions, because it's not just COVID-19. There are also other diseases like cancer that warrants or need our management.
Okay, thank you very much. Doc Emick?
So my last statement lang is, from the Philippine Society of Medical Oncology, our motto, our battle cry now is really, allow us to help you. Tulungan nyo kaming tulungan kayo. Meaning, whatever your needs are, risk stratification pa rin. If you are low priority, if you're only on surveillance, you are on survivorship follow-up, if you cannot go to the doctor's clinic or face-to-face, there's always telemedicine, teleconsult, and that can be arranged with our secretaries. And for those who are medium to high risk, please continue all the treatments and diagnostic workups as scheduled, because this is only a pandemic, but yung cancer yun mas nakakamatay because of the cancer and not because of COVID-19. So that's already proven. Ang mas namamatay sa COVID-19 na cancer patient is not because of the chemotherapy, it's not because of your hormone treatment that you're taking, but if you are an elderly, you have comorbidities, yun ang mas a high risk for dying from COVID-19.
Okay. I don't think that could have been said any clearer. So ladies, and I think we have some gentlemen out there, on behalf of the I Can Serve Foundation, please stay tuned for more talkbacks in the near future. In the meantime, you can go to our foundation page, to Instagram and Twitter, and our website for more information. And this one, as we mentioned earlier, is going to be, has been recorded and can be watched at your leisure. Thank you very much. This is your Tita Doris.
Thank you.
Thank you.
Thank you.